Good morning. Thank you, Professor Sumita, for giving me opportunity in this instruction course with eminent personalities like J.C. Das, Pradeep, Manish, Deepak, and Rita. Really, it is a proud privilege to be here. So, coming to my topic, defining advanced glaucoma and the quality of life of patients. I don't have any financial disclosure to make. As per the glaucoma, there is no particular nomenclature in the story. But however, when the current grading system of Humphrey's automated perimetry, 30-2 or 24-2 strategy defining the severity only. So consequently, upon the HPA system, it classifies considering the mean deviation and the pattern deviation and proximity of the defect in the fixation point. As per the Humphrey's visual field analysis, when we go through the stages 0 to 5 from ocular hypertension to the end stage of glaucoma, we define advanced glaucoma as the mean deviation when it is less than 12 decibel to 20 decibel. Along with that, at least one of the following should be there on pattern deviation plot, greater than or equal to 50%, but fewer 75% of points depressed below the 5% level, and greater than or equal to 25%, but fewer than 50% of points depressed below 1% level, or any points within central 5 degree of sensitivity of 0 decibel. This is important. Both hemifields containing a point with sensitivity of less than 15 decibel within 5 degree of fixation is important. Coming to this perimetric picture, it is obviously that when you see the picture, it sees, but actually, when you see the last one, you just miss, as it is advanced glaucoma, but actually, when the points of 0 decibel sensitivity within the central 5 degree, this case is an advanced glaucoma case. But as per the ICD classification, ICD 9 and 10 diagnostic code defines severe stage of advanced glaucoma stage and end stage of glaucoma as optic nerve abnormalities consisting with glaucoma and glaucomatous visual field abnormalities in both hemifields and or loss within 5 degree of fixation and at last one hemifield. So when we diagnose the case of advanced glaucoma and comes to quality of life, the quality of life is very, very important because whether you treat the patient or don't treat the patient, the patient does not have any interest on that. He is interested about his quality of life, how he is the biomedical indicator does not have much to help. How he is helped, that is important. So quality of life depends mostly on the psychological effect, visual impairment, visual field restriction, contrast sensitivity reduction, and glare, and medication of surgery of glaucoma. So usually in our life, the quality of life with our normal age and the degenerative quality of life decreases. So when at the far end, we diagnose the patient to be glaucoma, there is fear of glaucoma, and with the fear of glaucoma, there is financial, medicinal cost. Along with that, the limitation of daily activities like reading, walking, and ultimately the uncertainty of life with visual disability, limiting his disability and blindness causes the person to lead a sedentary life and his quality of life is disturbed. So the most important among them is the psychological effect of diagnosis. Because the fear of blindness, when we are talking of glaucoma, the blindness simultaneously goes. Whether when you go to a doctor, they go on telling, you will be blind, and there is some technical aspect also that anxiety, depression. It is estimated that 80% of glaucoma patients report anxiety and depression and fear of blindness. So acute emotional stress can trigger the intraocular pressure elevation glaucoma, making it a rotational cycle. So the most important is this fear of glaucoma that always hampers psychologically. Limitation of daily activities, that is also carrying out the task of walking or balancing, or reading, driving, and reaching, or grasping, or seeing a object face recognition is always difficult in case of this advanced glaucoma. Decrease in contrast sensitivity, glaucoma causes reduction in contrast sensitivity. This creates problem with night driving, including difficulty in seeing pedestrians and walking alongside with poorly lit streets. That also causes difficulty in driving. Driving in foggy conditions, that makes it very difficult. So face recognition, this is a social problem. When there is a face recognition, you suddenly cannot recognize a face of a certain person in a crowd. That you feel awkward. So when you are doing a tangential to visual field in mean deviation, there is a significant predictor of facial recognition. Patients with glaucomatous macular damage, they exhibit diminished facial recognition, which is partly mediated through diminished contrast sensitivity. So social interaction and their significant impact on the quality of life is very, very important. So this face crowding and cannot recognize a particular face in a crowd when it is person is little far away, mostly due to the macular damages. Tunnel vision. This creates a constricted field of vision due to the advanced glaucoma, and that is navigating crowded places is difficult. It leads to bumping into the objects, fear of fallover, or sometimes you fall over. That also creates problem. Reading disability. When we are aging and along with the advanced glaucoma sets in, the glaucoma itself causes problem. So slow reading and increased reading impairment with advanced bilateral field loss is there. Slow reading speed in glaucoma was closely related to shrinkage of visual span. Glaucoma patients take a longer time to focus on a target and identify letters. So affection of saccadic eye movements are problem. So reading is really difficult. And old age reading is sometimes the hobby. You take a lot of time in sedentary life, and reading, if problematic, is very, very difficult. Glare is one of the most important part of this advanced glaucoma. This is due to the decrease in the retinal ganglion cells layer or melanopsin, and along with that ocular surface disorders also contribute to the glare part. Difficulty in driving. When you are habituated in life, when you are driving yourself, when the driving becomes difficult with glare, low contrast sensitivity, facing problem particularly in foggy condition, during night driving, and with entering into a tunnel from a lighted area to the dark area, it is very, very difficult, and patients with moderate to advanced glaucoma are at higher risk of unsafe driving. And when you are not allowed to driving in the night or all things, sometimes your life is little dull. So higher risk of falling, this is very important. So it is either decreased balance leading to greater likelihood of bumping into objects, fear of falling, or slower walking speed. Avoidance of activity or reduction of travel outside the home. So taking all into consideration, the patient rate their quality of life lower if visual field happens quickly. So unlikely early stages in which visual acuity and visual field of the worst eye are the main determinants of quality of life. So the main impacting eye in advanced stages seems to be the best functioning eye. So along with when you are doing advanced glaucoma, your quality of life is also decreased, and simultaneously the medications. The doctor gives a lot of medicines. In glaucoma, either you single drop, double drop, 3 drop, 4 drugs. So a lot of drugs are there. In timely you have to put, your hands will be tremoring. You can spill over the drops itself. Frequent use of the drops, and along with this, all these things, the financial cost, that also hamper. Your income has decreased, and the medications price has every day increasing day by day. Newer drugs are coming, and the price is getting up and up. So along with the financial effect on medications, how to put and how not to put, then side effects of the glaucomatous drugs. There are a lot of side effects along with the medications. It also causes problem in hampering the quality of life. So all these things, either driving, night driving, or reading, not recognizing faces, all this leads to your loss of confidence. and that is where the doctor has to step in. No patient is interested, no patient is at all interested. Yes, your IOP is fantastic. You have got a fantastic IOP, but he is not interested about hearing that fantastic IOP. He is interested, doctor, I am using so many drugs. I am financially problem. I don't drive in the night. I have some other problem with the reading, with facial recognition. So the most important here is the role of the consultant of glaucoma specialist to please give a time with the patient. Give him a little time. A counselor may be there, he can give half an hour to 1 hour, but a doctor's 5 minutes is very, very important for the patient. And if you give a good counseling, he may lead a very interesting life, or at least whatever the life is there, he will be happy with his family and children. Thank you. Thank you.